Hello and welcome back to health class. Today we are continuing our unit on trending diseases with animal names, where we unseat the chicken from its domination of the US pox market, because a new pox is indeed in town, my friends, monkeypox. And here's what you need to know about it. If this is your first time in my classroom, hello, I am Liz. I am a family nurse practitioner, and on this channel, I do healthcare, education, and commentary type things. Today, we dive into monkeypox, which is not a new disease, but recently, it has been gaining popularity in spaces it typically doesn't hang out in, and therefore, it deserves a spotlight. So what the heck is monkeypox? Let's start there. Monkeypox is a zoonotic viral illness. Viral meaning the actual bug that causes this havoc. They're very, very small and they cannot be treated with antibiotics. And zoonotic meaning that the disease started in animals and then hopped over to infect humans as well. In the case of monkeypox, I'm pretty sure you can guess what animal the virus infected initially. Rodents, obviously. Rodents appear to be the animal that carry the illness at baseline, and monkeys kind of just got a bad rap with this one because in 1958, monkeypox was identified for the very first time when a group of monkeys being kept in a research facility contracted the disease, and that was when they were able to isolate it and get a sample of it from those monkeys because they had access to the monkeys, so then they named it monkeypox. Bad luck. Monkeypox was first documented in a human in 1970 and has been found regularly since then in several Central and Western African countries. Cases have popped up outside of these countries. However, historically, cases have been linked to international travel or imported animals from areas of Africa that it's kind of been endemic in or living there normally for years. That was until 2021 when cases started popping up slowly in other locations and spreading enough to get a foothold in different communities, slowly increasing its reach to now in 2022 we have 75 countries reporting cases, where normally there are not cases. Why? Because apparently we can't live normal lives anymore and the earth is literally just trying to get rid of us. So that's cool. Probably because we haven't always been really kind to it, so I kind of get it. But anyways, back to the pox. And the burning question that came to my mind when I heard of monkeypox is this better or worse than COVID, and what happens if I get it? So, tiny bit of good news here, just a tiny, not as bad as COVID, it would seem. Knock on wood right now. But still, monkeypox is very much not fun. When one gets monkeypox, they typically are sick for about 2 to 4 weeks, and during those weeks, people can expect to experience any of the following symptoms. Are you ready? Fever, headache, muscle aches, backache, swollen lymph nodes, those are the bumps in your necks and like your armpit and your groin area, chills, exhaustion, respiratory symptoms like a sore throat, nasal congestion, or a cough. So these symptoms usually will come first, and then a few days later the pox will show up. Hooray! What is a pox? I'm so glad you asked. You won't be. You'll see why. A pox is a rash that starts as a flat, red little circle area that is usually painful in the case of monkeypox. This flat little area will then fill up with fluid, making a blister, which will then turn into a pus-filled blister, which will then crust over and eventually fall off. And they will be everywhere on your body. Everywhere. They can be everywhere. And as with any illness here, we're gonna see this disease on a spectrum. Some humans, the unlucky ones, are going to get all of the symptoms. Some only get a few of the symptoms, such as maybe a few scattered pox lesions, a mild fever, general fatigue, and the luckiest of all humans have absolutely no symptoms at all, so that they can spread it around to others without anyone having an idea that anyone was even sick in the first place. 1 point goes to this virus for being an evil spy and us not being able to do anything about it. So that's cool. I also really want to emphasize how early in the research all of this is surrounding monkeypox, okay? Because it's still developing. We are definitely going to learn more about it in the future, but as of this day of filming, this is what we know. This information will almost certainly change, and that does not mean that there's a conspiracy at play here, okay? It just means that science is happening and it's working and developing and expanding, okay? And if there's anything I have learned from COVID, it is how to give a good explainer about how science works and does in fact evolve. All right, so to recap, monkeypox typically presents within a few days of feeling overall crappy in any variety of way, and then getting a painful spotted rash that starts as flat red dots, then it fills with fluid, which turns into pus, and then lesion crusts over, and then they fall off. So, yay. If this sounds generally familiar, you're like, I feel like I've heard of this before. It's because it's sort of on the surface, it sounds like chickenpox, right? I thought so too. A new pox, just like the chicken. But the infectious disease people said no. Apparently monkeypox blisters are different than chickenpox blisters. They're harder to break and much sturdier. A really weird way to describe a lesion, by the way, sturdy. They're more like waxy, and you are more likely to have lymph node swelling with monkeypox than with chickenpox. And they seem to be primarily affecting different populations, children being the primary people affected by the chickenpox, and monkeypox has been largely seen in adults so far. And apparently, despite the fact that they actually both are a pox, they are actually not related at all genetically, making my analogy in the intro very, very confusing. I apologize. Monkeypox is actually related most closely to smallpox, one of the most devastating diseases ever to have existed in the world, which very fortunately was completely eliminated worldwide through vaccination in 1980. Both smallpox and monkeypox are of the orthopox genus in the family Poxviridae. Fun random science fact to impress strangers with right there. Just tuck that in the back of your brain. So it's definitely generally a bummer, right, that these two, smallpox and monkeypox, are related, because prior to its eradication, smallpox caused a whole lot of trouble, which makes one a little bit worried that maybe this could do this as well, right? However, it also means that we have a lot of information surrounding monkeypox because we know so much about smallpox. Unlike when the recent pandemic happened and we were literally throwing like anything at the wall in hopes that it would stick and help relieve symptoms or help lead to a vaccine because we didn't even know where to start. We have a starting point here, and that's awesome. With monkeypox, there is no need to frantically search for a cure or a vaccine, and we don't need to run around Cloroxing all of our groceries because we already have both a treatment and a vaccine. Yay for small wins. Well, I mean, hold on to that thought, because the vaccine and the treatment, they exist, right? They're just not readily available. But let's learn about them first, and then we can discuss the small problem of us not actually having access to them. There are two vaccines at play here for monkeypox, okay? Both of these also target smallpox, because smallpox was the real reason these vaccines were made. Nobody had monkeypox becoming a big issue on their bingo card of life, apparently, and 2022 laughs at our ignorance. The two vaccines are ACAM 2000, which is the vaccine that eradicated polio back in 1980, and it works for sure, and we actually have a decent chunk of it stored away in the United States, but it has quite a few side effects and a higher risk profile than the much newer JYNNEOS vaccine. I don't know if I'm saying that right. We're gonna go with it. The JYNNEOS vaccine has far fewer side effects and a much more milder risk profile. JYNNEOS would far and away be the vaccine of choice here, and had this happened like 8 years ago, we would be totally fine because we had 20 million doses of JYNNEOS stockpiled in the United States. Why did we have 20 million vaccines? That seems like a lot. Well, yes, it was a safety thing. There was a concern that smallpox may be revived and used as a bioweapon, so in like anything terrorist related, so they created a whole bunch of the vaccine just in case. But whoever was really worried about that threat when they ordered all of the vaccines must have gotten a new job and like moved on, because when the 27 million doses hit their 3-year shelf life in 2017 and expired, nobody ordered new ones. They were not replaced because they were putting most of their money into trying to fund a way to find freeze-dried, more shelf-stable versions of the vaccine, but the FDA hadn't approved that yet. So all in all, in theory, is great because then you wouldn't need to replace the whole stock every 3 years. And I'm sure that poor soul sat there and figured, what are the chances? What are the chances that we will need this 27 million stockpile before we get FDA approval on the actual shelf-stable vaccine that we want? Let's not order both. Let's save money. Only to have that bluff called by Monkeypox, who showed up as an unexpected guest to the end of a disastrous COVID party that stalled FDA productivity for 3 years running and now requires this very random specific vaccine for a disease we thought was gone. Side note, those expired monkeypox vaccines, did we give them to a country that has endemic monkeypox in Africa that could have really used them because they have monkeypox? No, of course not. We let them expire and threw them away because we love wasting money and are selfish. Which reminds me, it's time for you to visit billing department. Liz, see you soon to discuss treatment, which is not any more helpful. On that happy note, there, I left the file right up. Oh, hello again, friend. For today's copay, I wanted to share with you an item that will help you pay for your future copays. Very generous, I know. So tell me, how do you feel about writing resumes? Cover letters? Same. I'd rather go to the dentist, and that's saying something. But no fear. I know a gal named Amanda who runs the Resume RX, and she has created a beautiful resume and cover letter templates just for you. They're geared towards nursing and nurse practitioner jobs, but you could probably use them for anything. And all you do is you plop your information into the resume where it is requested. It'll tell you. It's so easy. And off you go. You look much more polished than you feel on the inside. And did I mention you have options? Yes, this bundle comes with several options for whatever your own personal style is. YouTube Liz has used these for years and received lots and lots of praise on them. Between me and you, I think she sometimes takes credit for coming up with the resumes herself when she's in job interviews. I know. If you would like to take credit for someone else's design in a job interview, you can visit the link below to snag a resume bundle, and you get an extra 20% off because YouTube Liz and Amanda are friends and she's an affiliate of the program, which basically means that you get a discount and Liz gets a small kickback. What do I get? I unfortunately don't get anything out of the deal, but that's the life of being a biller, okay? All of the patient complaints and none of the profit. It's fine. Everything is fine. Anyways, definitely check it out if you need a resume update. I'm using it now to find a job and it's very easy. Oh, I probably shouldn't be saying that out loud. Okay, well, bye-bye for now. I'm gonna go do these files. You take care. Yeah, bye-bye now. I should learn to keep my mouth closed. Leave it to the complete failure of our public health system to make billing Liz seem like a good time. Yikes. So yeah, do we have a vaccine? Yeah, we do. Can most people get it? No, they can't, because we only have around 375,000 doses, and shockingly, they're not being distributed super duper well. But apparently they are making more, and it's supposed to be largely available in like October-ish. So for now, prioritization is being put on the vaccination for the most at-risk populations, which we will look at in just a minute. But now let's top all of that simmering anger off that you are feeling inside of you about how poorly we do in public health with the treatment options. First of all, sort of good news, you most likely don't need a treatment. Monkeypox is referred to as a self-limiting illness, which means it will resolve on its own within 2 to 4 weeks, but many people would appreciate having something to help them with their painful rash affecting their entire body. And for that, the best thing we seem to have is a medication called tecovirimat, or TPOXX, which is the treatment for smallpox, but also seems it may help reduce the severity of symptoms for monkeypox, or in some cases maybe keep you from getting it. We're not sure yet. We're waiting on science. The medication is not FDA approved for the treatment of monkeypox because, again, was not on the bingo card of life, but the CDC enacted their non-research expanded access investigational new drug protocol thing that allows for the use of TPOXX for those with monkeypox. If you can get your hands on it, and it arrives before your body fights the thing off by itself, and your provider thinks you would benefit from it and is willing to prescribe it, and is willing to do the work of all the paperwork to get you an experimental medication that may or may not work. What I'm trying to say is you likely will not be getting the medicine TPOXX, at least that's how things stand right now, if you get monkeypox, okay? Which stinks because I heard it's miserable and feels like you're being stabbed with glass, which is not fun. But will you die? Probably not. The current circulating version of monkeypox is the West African strain, and less than 1% of individuals who get this version of monkeypox become seriously ill and die. Bonus. This is compared to the Congo Basin type of monkeypox that has a fatality rate around 10%. Again, we did not share vaccines with countries that have a disease with a 10% mortality rate. Why? But as we know, with all other diseases, did you die is not always like the best way to evaluate how serious something is, right? Monkeypox causes severe disturbance in day-to-day life, is quite painful, and causes an inability to participate in life. And we aren't quite sure yet what other long-term, like other than scarring, things might happen. Also, if you get monkeypox, you have to quarantine, which, as we all well know by now, causes a whole boatload of different stressors. Next question that I had, are there groups that are getting hit harder than others? Excellent question, past self. Individuals who have weakened immune systems, children under the age of 8, and those with a history of eczema, and pregnant and breastfeeding individuals do seem likely to have more severe cases, but we really don't have a ton of data on that yet, and this is something that we're going to be seeing hopefully as we develop more case data, but then more people are getting it, so I'd feel bad saying hopefully about that, but you know what I mean. Okay, so we know what it is, and we know what happens when someone gets it, and now let's talk about how to try to avoid getting monkeypox, okay? Because remember, we don't have a really great way to fix it at the moment. I thought we would bring in one of our nation's leaders to help us figure out how it is spread. I would like everyone to give a warm welcome to U.S. Representative Marjorie Taylor Greene as she comes to the video.
Of course, monkeypox is a threat to some people in our population, but we know what causes it, and that's pretty much, it's basically a sexually transmitted disease. So it's not a threat to most of the population, and so it's not a global pandemic. It's really not, and people just have to laugh at it, mock it, and reject it. So I think it's another scam.
Oh, well. That was horribly embarrassing. So none of that is true. None of what she said right there was true. Imagine that, false information being spread by powerful individuals in our country who have absolutely no idea what they're talking about via the media, who apparently doesn't run anything by anyone who has ever worked in healthcare, ever. So, seems legit. Good. Monkeypox. Okay, listen to me. Monkeypox is not a sexually transmitted infection. A sexually transmitted infection is one that's primary mode, so the most common way, the biggest way it gets transmitted is during the act of sex. The only reason I feel that this is important to clarify is because many people still have a lot of really hardcore stigma surrounding STIs, and that can be weaponized easily as a fuel to a that's a you problem, where people like MTG pretend that she's never had sex in her life, and so obviously this isn't something that affects good people like her and you, and we therefore don't need to deal with this conspiracy disease. Okay, that's not the attitude we're trying to get here. And on top of all of this, an added layer that seems to encourage many people to see this as a other person issue is the fact that currently in the United States, 95% of cases of monkeypox have occurred in men who have sex with men. And just like COVID was only a problem for people with chronic disease, monkeypox now seems to be only a gay people problem. Because you know, we love a good deflection story here. Not my problem, but I personally think that all humans deserve the benefit of public health and disease management. So let's proceed with how this is spread and what we can do to prevent it, because I don't think I'm the only one realizing that while it may primarily be affecting one population at the moment, first of all, they deserve just as much care as everyone else. And second, those numbers will change, because that's always the trend when looking at historical infectious diseases, okay? It does not stay in its bubble. So, if it's not a sexually transmitted infection, how is it spread? Monkeypox appears to be primarily spread by contact, touching people, touching things that touched the people. It's similar to things like chickenpox, MRSA, and the ever popular stomach bug, okay, that makes you barf and poop and all the things. Contact can be direct contact with monkeypox rashes, scabs, or bodily fluids from a person with the disease. And the fewer barriers and longer contact time you have when touching someone with monkeypox, the more likely you are to transmit or receive the disease. So, the more naked the activity, the more the risk, because there's more skin touching. So yes, many cases of monkeypox have been transmitted surrounding sexual relationships, but not because it's a sexually transmitted infection, but because that is frequently a no-clothes situation, and we know those encourage the spread of contact-borne diseases like monkeypox. Are there other ways to spread it other than having sex? Yes. There are many less fun ways to get monkeypox, such as touching objects, fabric, and surfaces that were used by someone with monkeypox. And in some cases, it seems to be transmitted through respiratory secretions. A pregnant person can also give a fetus the virus through their placenta, or you can consume animal products, come into close contact with, or be attacked by an infected animal. Again, most of those animals are going to be living in the continent of Africa. At this point, It is up in the air of how long monkeypox seems to be able to infect things. After it is on a surface, like how long it will live, and you go by and touch it, how long is that a viable thing to then get you sick? But we do know that you can spread the virus the whole time you are sick, which remember was 2 to 4 weeks, and nobody has time for a 2 to 4 week quarantine, my friends. So prevention here is key. How do you prevent it? You can try some of these things. 1, avoid close skin-to-skin contact with people who have a rash that might look like monkeypox. Avoid being intimate with someone with monkeypox or someone who was recently exposed to monkeypox. Avoid contact with objects and materials that that person with monkeypox has used until it has been completely disinfected. Wash your hands, the golden rule, wash your hands often with soap and water. And if you are in an at-risk group, and right now those groups are people whose job exposes them to monkeypox, people who have a sexual partner that was diagnosed within the last 2 weeks of monkeypox, people who have had multiple sexual partners in the last 2 weeks in a known area where monkeypox is out and about, and people who come in any contact with someone who has had monkeypox. Individuals in that group I just described should try to get the vaccine to hopefully prevent disease or limit its exposure. And if you aren't sure if it's in your area, you can check your local health department, and you find out your local health department by Googling your county that you live in, followed by the words health department. That one's yours. And finally, what happens if you are exposed to it? If you are exposed to it or you acquire an unexplained rash or other symptoms where you feel generally unwell, you should probably avoid close contact with anyone until you have seen a healthcare provider or visited a public health clinic near you. Make sure to wear a mask and inform them of your symptoms before you show up. That's very rude to just barge in and be like, I think I have monkeypox, touch everything, cough. I'm not scarred from COVID, it's fine. But when you do go to the provider, it may shock you to know that testing, I know, shocking, is not super available at most labs, but some are offering it. And if your lab is, your healthcare provider may swab one of the lesions. It's not gonna feel super good. They're gonna scrub it and get its juices out, and they will scrub it and send it off to see if it's monkeypox. However, most people are being diagnosed at this point without tests due to its limited availability and overall low accessibility of being able to go see people in general in the healthcare system. If you do have symptoms or are diagnosed with monkeypox, you should notify all the people you came in close physical contact with over the last 14 days and quarantine at home until your lesions have resolved. If you're quarantining with a pet, this is sad, keep in mind that mammals, pets, can get monkeypox, although common pets like dogs and cats are less likely to get monkeypox than animals like rodents, but still, you're gonna wanna probably avoid food sharing, avoid cuddling, snuggling in bed, kissing, basically avoid any contact with them that you will likely desperately want because you are home alone with just your pet in quarantine. Try to avoid that just so they don't get it. This will help reduce transmission, which is very, very important. And that, my friends, is monkeypox in a nutshell. Please do help raise the vital signs of this video by liking, sharing, leaving a comment or a question, or you can improve the health of the channel overall by subscribing or becoming a member for fun perks, rambles, and who knows what else, like these lovely humans on screen. Thank you so much for sharing some of your precious time with me today. I hope you always remember that you are not alone, you are more than enough, and you, my friends, can do hard things. Until next class, I will see you later. Bye.